Hello and welcome back to my channel One Loves Healthcare. This is Dr.PRJ and today we will be discussing regarding an important condition involving the thyroid gland known as hypothyroidism. But before we come to that, let's get to know a bit about the thyroid gland. The thyroid gland is an important organ located in the front of the neck that regulates the metabolism of the entire body. This gland makes hormones commonly known as the thyroid hormone. This hormone is produced in two forms and they are secreted directly into the blood. The forms of this hormone are thyroxine T4 and triiodothyronine T3. Now the question is, what is hypothyroidism? Hypothyroidism is when the thyroid gland is not producing enough of these hormones. Primary hypothyroidism can affect the whole body but may also cause a variety of symptoms. Having too little thyroid hormone can affect the whole body. The body's normal rate of functioning can slow down and can cause mental and physical sluggishness. Symptoms may vary from mild to severe. What will you experience if you are a patient of hypothyroidism? Symptoms can differ from person to person. However, they are slowly hard to notice and they start very slowly. They may be mistaken for symptoms of depression, but here are some of the common signs and symptoms seen in a patient of hypothyroidism. They have a dull facial expression, a generalized tiredness and a lack of energy known as fatigue. They are not able to handle cold weathers. They have a hoarse voice, a deep, slow speech, droopy eyelids, puffy and swollen face, weight gain with constipation, sparse, dry hair, coarse, thick skin, hand tingling and pain in their wrist, also known as a carpal tunnel syndrome, a slow pulse, muscle cramps, joint pains, sides of the eyebrow may become thin or they even may fall out, generalized confusion and increased or irregular menstrual flow in women is also noted. Now we know how it looks like. The better question is, how is it diagnosed? By examining your past health and performing a comprehensive physical exam, the following procedures will be done. Blood tests are very important in this condition and can help to diagnose hypothyroidism. Laboratory tests to determine thyroid function include the thyroid stimulating hormone TSH helps to understand whether the thyroid gland is working correctly. Measurements of the two forms of the hormones T3 and T4 mentioned earlier also provides this necessary information. Serum T4 levels are low whereas the TSH levels are high. Serum cholesterol and triglyceride levels are also raised. Serum lactate dehydrogenase LDH and a creatine kinase CK levels are also raised. Serum sodium levels are low. Electrocardiogram demonstrates a sinus bradycardia, a low voltage QRS complex and ST wave abnormalities. Chest radiographs may show an enlarged cardiac shadow after dealing with Now let's look at some of the causes of hypothyroidism. The most common cause of hypothyroidism is an autoimmune condition known as Hashimoto's thyroiditis. This means that your immune system has started to attack itself. It makes antibodies against the thyroid gland. The normal thyroid cells are overrun by the white blood cells and form scar tissues. Sometimes hypothyroidism occurs after the treatment of an overactive thyroid gland. They may include radioactive iodine therapy or surgery. Hypothyroidism may also develop shortly after pregnancy. A condition known as secondary hypothyroidism can also sometimes happen. It is when the pituitary gland in your brain stops working. The pituitary can no longer tell the thyroid gland to make its hormones. Hashimoto's thyroiditis. Hashimoto's thyroiditis is a type of inflammation of the thyroid gland that results from an autoimmune process. The most common cause of Hashimoto's hypothyroidism is autoimmune. However, some individuals with Hashimoto's thyroiditis may never develop hypothyroidism as they have no symptoms. How is hypothyroidism treated? Treatment will depend on your symptoms, the age and the general health. It will also depend on how severe the condition is. The goal of the treatment is to return the levels of your thyroid hormones back to normal. You may need to take medicines that give a dose of the thyroid hormone replacements. The dose may need to change over time. You will likely need to take these medications for the rest of your life. You will need to follow up blood tests to make sure that you are taking the correct dose of thyroid hormone replacement. A general, in-detail treatment will be given by me subsequently by administration of T4 hormone. But it is always important to remember that this video is for education purposes only and the following regimen may not suit you, and self-medication without a physician's consultation can be dangerous. Thyroxine hormone T4 is usually given at a dose of 50 micrograms per day for 3 weeks, followed by 100 micrograms per day for 3 weeks, followed by a maintenance dose of 150 micrograms per day. The correct dose of T4 is that which restores the serum TSH levels to below than 3 milliunits per liter. It should be given on an empty stomach in the morning. In elderly patients and those with ischemic heart disease, T4 is started at a lower dose of 25 micrograms per day. In a few patients with ischemic heart disease, angina may develop or may worsen with T4 therapy. They should always be treated with beta blockers and vasodilators, or a CABG or a balloon angioplasty may be performed on such patient. This allows a full replacement of the dose of T4. There are special considerations for women who have had thyroid disease in the past or currently and who might be considering pregnancy or are already pregnant. Increased monitoring and adjustment of the thyroid related medications is recommended during this period for the health of both the mother and her baby. Special planning might also be necessary for the women with such conditions in which